The U.S. authorized the first major makeover of the COVID-19 vaccines this week in an effort to stem an expected tide of infections and hospitalizations this fall. But it's unclear how much protection the new booster shots will provide. The Food and Drug Administration and the Centers for Disease Control and Prevention cleared the shots without any data from clinical trials that are testing the reformulated doses in humans. The new boosters, authorized for people ages 12 and older, target the highly contagious and immune-evasive Omicron BA.5 subvariant that has caused a wave of breakthrough infections over the summer. The shots also target the original strain of the virus that first emerged in Wuhan, China, in 2019. The nation's top health officials acted with urgency this summer to ensure the new boosters would roll out in time for the fall. They are worried that the waning effectiveness of the old vaccines is creating an opening for Omicron to cause another wave of hospitalizations this winter as people spend more time indoors where the airborne virus spreads more easily. Deaths and hospitalizations have climbed since April among the elderly, the most vaccinated age group in America, as Omicron has continued to mutate into more and more transmissible subvariants that dodge the protection of the original vaccines, according to Heather Scobie, a CDC epidemiologist. Dr. Peter Marks, who heads the FDA office that reviews vaccines, said the new boosters aim to restore the high levels of protection that vaccines demonstrated in early 2021. But Marks acknowledged that the federal government's experts simply do not know yet whether the boosters will meet the high bar set by those doses. "We don't know for a fact yet whether we will get to that same level, but that is the goal here, and that is what we believe the evidence that we've seen helps point to," Marks told reporters during a news conference after the FDA authorization Wednesday. "The FDA will conduct surveillance to see whether the boosters meet that goal," Marks said. When Pfizer's and Moderna's shots were authorized in December 2020, they provided more than 90% protection at preventing COVID. Marks told reporters it will likely take at least another couple of months before human data on the BA.5 boosters is available to the public. But he said the FDA used basically the same process to authorize the new boosters that it has relied on for years to switch the virus strains in flu shots. "We're pretty confident that what we have is very similar to the situation that we've done in the past with influenza changes where we don't do clinical studies for them in the United States," Marks said. "We know from the way the vaccine works, and from the data that we have, that we can predict how well the vaccine will be working." The new boosters could prevent 2.4 million infections, 137,000 hospitalizations and 9,700 deaths if a new variant doesn't emerge, according to a projection by a team of scientists that forecasts the trajectory of the pandemic, called the COVID-19 Scenario Modeling Hub. But that projection is based on optimistic assumptions about booster coverage and efficacy. According to the scientists, the model assumes that the shots will prove 80% effective at preventing illness and the public will broadly embrace the new boosters. There is no efficacy data on the new shots and it's unclear how strong public demand will be for them. The CDC estimates that an early fall vaccination campaign with boosters could save the U.S. between $63 billion and $109 billion in medical costs by preventing hospitalizations and ICU admissions. Pfizer and Moderna were originally developing new boosters to target the first version of Omicron, BA.1, that caused the massive wave of infection and hospitalization last winter. But keeping up with the rapid evolution of the virus has proved challenging. By the time the nation's top health leaders moved in earnest in April to get new boosters ready, more transmissible subvariants had already driven Omicron BA.1 out of prevalence. In June, the FDA asked the vaccine makers to switch gears and target Omicron BA.5 after it rose to dominance.